I don't know whether I get this position because I'm an ex-school teacher and I always found the last lesson of the day to be the hardest one to get through, but I'll do my best and I can assure you it won't be a 40-minute one. I'd like to begin by acknowledging the traditional owners and custodians of the land on which we meet today and pay my respect to their elders past and present. I extend that respect to any Aboriginal and Torres Strait Islander people here with us today, and I have been observing over the last couple of days the number of Indigenous and particularly community members who are here contributing so strongly. It's great to see. The discussions, I might just say that I'm actually a proud chair of Health and Wellbeing Queensland. I've been around for a while, but this is the best gig I think I've done in a long time. And one of the reasons is that this organisation is positive, has direction, and is supported, and the number of you are here with your support. It's grateful from the board perspective to see that support and to know that we've got people out there who will work with us at every opportunity. I chair a very diverse board, and it's a great board to work with. And the one thing that we have particularly, I think, in common, if I can just highlight one part of it, is the fact that we are focused on Robin's work as CEO in determining as many community partnerships and multi-sector partnerships, to use Karen's words from her slides, as we can find in Queensland. Obviously, we can't help everybody right at this moment, but I can tell you from the board perspective, we'll be out there looking for you and trying to work with you. If you've got good ideas, give them to us. The importance of investing now cannot be overstated. 2 in 3 adults, almost 1 in 3 children in Queensland live with overweight or obesity. By working together and prioritising prevention, we can reverse this trend and create a healthier Queensland for generations to come. I particularly want to thank Madonna King. I used to work with Madonna many years ago. I'm not sure whether it was work, but I used to know Madonna in a previous life, and I always found her an interesting person to be interviewed by, and I always tried to, and then I felt for you there, John, too, because I've encountered that a few times myself. But look, I want to thank you, Madonna. You've done a great job as a chair of the compare of this conference, and I thank you for your attention to detail and the depth of detail you've gone into in terms of the questions, which is something I had to deal with about 20 years ago. But put your hands together for Madonna. Thank you. After reflecting on the past 2 days of conversations, 3 key needs come to my mind. First one is that we need to embed prevention into clinical care. The sooner we do it, the better, and catch health issues early. Secondly, improve the environments in which Queenslanders live. Current surroundings don't support people to eat healthily, move more, and connect with others. Make the healthy choice the easy choice. And as I said, foster strong partnerships across government, industry, and community. None more important than the partnership between Health and Wellbeing Queensland and Queensland Health, and I acknowledge all the Queensland Health people who've come to this conference and supported it so strongly. Thank you. If we can meet these needs, it will not only benefit each of us as individuals, but it will also strengthen our entire healthcare system, making it more resilient and effective. Whether you're a healthcare provider, a policy maker, or a community leader, you have a crucial role to play in this mission. The one thing we need to do, though, and I think John pointed it out, we take the insights and the inspiration from this symposium and now try and turn them into action. Together, we can create a healthcare system that doesn't just treat sick but actively promotes and builds health. I want to close by thanking a few people. Firstly, the staff and everyone who works at Health and Wellbeing Queensland, led by arguably one of the best CEOs I've ever worked with. I want to thank you all for the teamwork that goes into Health and Wellbeing Queensland, and as a board chair, I think that's the most significant thing that we have in this organisation, a combined and united team who work for the people of Queensland. Thank you all. I'm not going to name anybody, but thank you all because you do such a great job. Thank you to Her Excellency, the Governor of Queensland, for her support and advocacy, which has been ongoing since we began. And the Governor, for those of you who don't realise, is our patron and is so strongly supportive of us. Thank you to the Premier of Queensland for establishing us and trusting us with this important work. And I've been on the board of Health and Wellbeing Queensland since it was an interim board when it was set up by the then Health Minister. It just happened to be Stephen Miles. It is a great organisation and we look forward to working bigger and better for the community of Queensland. I want to single out one person in health, and that's Frank Tracy, who has supported me from my introduction to health, because coming from the education sector, I didn't have a great handle on health, but I thank Frank Tracy, one of the first people I met in the organisation, and can I also thank the current Director General of Queensland, because I worked with him at one stage in education, and I found his encouragement of Health and Wellbeing Queensland to be a big plus to the organisation. Can I also thank the previous two ministers, in Stephen Miles and Yvette D'Arth, and now with the current Minister in Shannon Fennerman, for the support that they give this organisation. Finally, when Robin was interviewed for the position, when asked about her legacy, she said two things. She wanted us to be the reason why obesity rates actually dropped on the charts. She wanted to create a system of good health where the government didn't need to take the lead. She's achieving that. I think the Board of Health and Wellbeing Queensland are overseeing that work, but all of the work that's being done between Queensland Health and Health and Wellbeing Queensland is appreciated, I'm sure, by the people of Queensland. I thank you all for attending today. It's been a pleasure meeting many of you. And if I can just comment on two things that I picked up in this conference. From participation, everyone was participating really well, but I saw a couple of nervous people, I won't name them, a couple of nervous people ask a couple of very, very good questions. To me, that's a good point of any conference like this. Thank you and good afternoon.